Welcome to the Leaders Eat Last panel discussion. My name is Martha Raddatz. Food insecurity is a complex and growing problem for families and the military veteran community. To solve a problem, we first need to understand it. That's why the Bob Woodruff Foundation, in partnership with Newmark Philanthropies, is assembling experts for Leaders Eat Last, a panel series designed to raise awareness, build understanding, and identify challenges and solutions. Prior to the pandemic, an estimated 10.5% of U.S. households experienced food insecurity. This rate was higher among the military veteran population, with 12.5% of veteran and military households experiencing food insecurity, and 28% of military families with children in school participating in free and reduced meal programs. The pandemic exacerbated the food insecurity issue by contributing to increased unemployment and financial strain, as well as challenging traditional avenues for food assistance. We have an esteemed panel today who are determined to tackle this battle and work together towards solutions. Please welcome Craig Newmark, founder of Craigslist and Newmark Philanthropies, Anne-Marie Dougherty, CEO of the Bob Woodruff Foundation, Katie Fitzgerald, Executive Vice President and COO of Feeding America, Nate Mook, Chief Executive Officer for World Central Kitchen, Karen Pearl, President and CEO of God's Love We Deliver. Welcome all. Craig, I want to start with you. You're a technology entrepreneur, advocate of democracy, philanthropist. So tell us about your initiative with Craig's Table, why you got involved with tackling food insecurity.
Well, food and hunger in America has always been a problem, but until recently, I was able to rationalize and ignore it like lots of people. But then I read that the pandemic had greatly increased hunger in America. And then I read that a lot of veterans and their families, and even active service members and their families, were going hungry. So this pissed me off. I decided to get actively involved, worked with a lot of organizations involved in food security, worked in particular with the folks at Bob Woodruff Foundation and Got Your Six to get people together to do something real about this. I helped out with some influence, with some funding, and then now my job is mostly to nudge them and otherwise get out of the way. They know what they're doing, and it's time to let them do their job.
You're very good at nudging, as we all know, but talk a little bit, Craig, about why it's so important to collaborate on this issue.
Well, usually when there's a lot of groups across the country doing a lot of good work in many areas, food insecurity is just one of them. But I think we get more done when people work together in a way where not only we get people fed, but we create an expectation that we're all in this together, that we owe each other something, and that sometimes we really are a brother's keeper. So the more people working together, the louder we are, the more expectations are set so that it's expected and normal to help out. This is what happened in the 30s and 40s with the greatest generation. Frankly, that's my target.
Anne-Marie, I want to turn to you to talk about the prevalence with veterans, military communities, and how the pandemic has really exacerbated food insecurity.
Thanks so much, Martha. I'm happy to add some additional context. Food insecurity in the military veteran community, it was kind of a hidden problem, and the pandemic basically just put a glaring spotlight on it, like you're hearing from all of us. Folks may not realize how prevalent this was even before COVID. Prior to the pandemic, 88% of our partner organizations in communities all across the country that serve veterans with food and nutritional needs said that they only had only 27% of those partners had the resources to meet those needs, and that was before the pandemic. This time last year, so April 2020, we published research on the projected impacts of COVID on veterans. And our research indicated that emergent trauma, unplanned job and wage loss, and increased social isolation would threaten the health and wellness of many veterans, including veteran food security. And unfortunately, we've seen a significant increase in veteran food insecurity rates this past year, as you can imagine. The Institute for Veterans and Military Families published a poll showing that as many as 40% of military veteran households have experienced food insecurity during the pandemic, which is just hard to imagine.
Katie, how has Feeding America reacted to the growing numbers of those who suffer from food insecurity, especially because of the pandemic?
I'm a former food banker myself before joining the national organization, and one of the most, I guess a good thing that came out of this, although it's highly regrettable, is that people really in this country finally understand that food insecurity is real in America, because everyone's been able to witness it happen in such rapid time. There were 35 million people who were food insecure before the pandemic. We think that number is closer to 42 to 45 million now as we project going further into 2021. And it was a perfect storm for the charitable food system. Demand, as you can imagine, had skyrocketed. It has been sustained at an average about 50% increase in the number of people showing up at food banks and pantries all across America. And so we've seen this rapid increase in demand. We also have seen an increase in supply. So the network has responded by increasing by 50% how many meals we've distributed. So if you look at 2019, we distributed about 4.2 billion meals through the 200 member food banks and about 60,000 partner agencies. When you look at the year of the pandemic, from March to March, we distributed 6.3 billion meals. So we're really proud of food banks and agencies that are just your faith-based organizations and community partners all across America, people who kept showing up to help their neighbors in this incredible time of need. And then lastly, I would say the operating model was a great a way in which we were really able to be agile and adaptive. In a normal environment, non-pandemic, we rely on about 2 million volunteers a year to help make those meals available to people. And of course, that was greatly disrupted by the fact that people very wisely couldn't come out or wouldn't come out to help. This is where the partnership with the National Guard was incredible. 50% of our food banks use National Guard forces to help distribute food. And then we were able to optimize a low touch, no touch distribution model and really accelerate some of the digital solutions we have, like something we call Order Ahead, where neighbors experiencing hunger can just order what they need from their local food bank or agency and pick it up at a place that's convenient for them. So we've seen a real rapid acceleration in that kind of innovation. So, Perfect Storm has resulted in showcasing what people can do, to Craig's point, when you come together and decide together to tackle an issue.
It really has been extraordinary. And Nate, World Central Kitchen's nationwide emergency food relief program includes partnerships with restaurants. So how were you able to adjust and really even expand support for the restaurant business, which was so hard hit during the pandemic?
Absolutely. I mean, this was an industry that was completely decimated and made up for the vast majority of job losses, especially in March and April of 2020. And as both Craig and Katie noted, we were seeing levels of hunger in this country that we've never seen before. And folks who traditionally have not had to rely on these social safety nets, all of a sudden were needing this support. And so as we looked at the challenges ahead of us in the beginning of the pandemic as it was unfolding, we saw that we were going to need some new solutions to augment some of the existing support mechanisms that were already in place. And one of those things that we saw that we could sort of connect two things together is putting our restaurants back to work to feed the communities. We really saw that if we were going to create an environment that was where folks were going to be able to support themselves, we needed to get the mechanisms of our economy working again, right? Because we had a global health crisis that then became an economic crisis that then turned into this humanitarian crisis around hunger. So World Central Kitchen, through our networks across the United States, we activated close to 3,000 restaurants in big cities and small towns, and we paid those restaurants to produce meals so they could keep their employees, working and paying their paychecks. Those restaurants could keep buying from their local distributors and the local farmers. So you keep that sort of whole mechanism going with the idea that, A, we're going to keep more people off the rolls of needing to go get food, but at the same time, you're getting that sort of the wheels of the economy working again, and hopefully sort of sustaining during this really difficult time. We met so many restaurant owners that were just going to shut down forever. They were just going to close up shop and never come back again. And so while World Central Kitchen wasn't coming in to replace all of their business, we could be a bit of this bridge during this really difficult time when the restaurant industry really had no business, and in turn use that resource as a way to support the community. And what we saw was amazing. I mean, restaurant owners all across the country jumped into this and were so eager to support and serve the local communities. And many of them have continued on, even if we don't no longer have funding specifically for them, they found other sources of funding. And it's been really amazing to see that response to the community. So again, a lot of new, interesting, innovative ways, that were just necessary because of the scale of the challenge that our country was facing and continues to face.
And Karen, I know that God's Love We Deliver was founded in the 80s to serve AIDS patients during that terrible global crisis. So what parallels have you seen between that time of crisis and what's happening now in terms of solutions when it comes to food insecurity?
I think the parallels are remarkably obvious and kind of, as we went through it, we kept saying to ourselves, this just feels like then. So when people are really, really sick, and we serve people who are sick, it started, as you said, during AIDS. And when they're really sick, the first thing that falls apart is, in fact, their ability to take care of their very basic need, which is food. And we kind of knew that and jumped into the moment because we were forced to literally overnight. I mean, we're based in New York City. We serve the New York City metro area. We got 3,500 phone calls from people saying, I need your help. I have no food. And like you've just heard about, it was the partnership. It was the partnership between philanthropy, like Craig's Philanthropy and others, and the partnership with our community who come in to volunteer every single day, who continue to come in even though they themselves were frightened. And then, of course, our staff who showed up every day to cook and package and then home deliver. So we completely changed everything about how we were working overnight, as we did way back when. But we had to change it to have no contact deliveries, but to make sure that the delivery was still done. So, and also that the social connection and the checking in on somebody happens. So, knock on the door, step away, make sure that the person feels cared for and knows that somebody's looking in after them. We've always served veterans, and we've always been very proud of that. It's been, an honor to do that kind of service to people who've done service to our country. But one of the things that has really changed is, I think, the needs of veterans, because earlier on, so many of the people that we were serving had physical illnesses, mostly only, and we were there to help them with that. And still people get on our program because they have physical illnesses, but they also have about 87%, I think, are living with multiple diagnoses. And that's really pulled in a lot of behavioral health diagnoses, whether that's PTSD, whether that's depression, anxiety, whatever it is. We're going to launch a pilot program now to deal with that very nature and have people come on our program who may be having behavioral health issues as their primary diagnosis. So we're really excited to be launching that and to move from serving people who just come to us to actively finding the vets who need us. And that's, again, going to be a great honor for us.
So Katie and Nate, we know you both work on advocacy initiatives at the state, the federal level. Are there any state or federal initiatives in the works, and how can they be supported at the local and community level for a broader impact? And Katie, go ahead. You start.
Sure. So yes, the answer to that is yes. There's a lot that can be done by everyone at every level. And it's as simple as using your social media and getting engaged that way to definitely making calls on your legislators. The things that we're most interested in advancing that require all voices, all of those that are here at this table that's been brought together and people throughout the country, is to make sure that the SNAP benefits that have been put into place as part of this pandemic continue the duration of the economic downturn. One of the things, so we've been pleased to see that those have been extended, but we very much believe that they need to be extended even further. There is a revision of the thrifty meal plan underway now through executive order by President Biden, and that's very encouraging because that may change the essential rubric upon which those benefits are cast. And I think the last time that was done was in the 1970s. So long overdue, and we're excited by that. The second major thing that we are talking with leaders at the state and especially the federal level around is the federal commodity cliff, which is availability of food through the USDA, which before the pandemic, we were looking at about a 30 to 50% decline expected in that available food because of a mix of programs that were coming to an end. The Trump administration and the Biden administration really did increase investment in that area, and we're looking very much forward to additional investment out of the American Rescue Plan, as well as we're advocating for more funding through TFAP, which flows largely through food banks, but into community-based organizations that are working in partnership with the folks on this panel as well. And then I would say, another major thing we're looking forward to that people should get educated about, and you can get educated through, I'm sure, all our organizations, is the Child Nutrition Reauthorization Act. What was so vital during the pandemic was a loosening of restrictions that make it difficult to meet the needs of American families today. I'm a parent of 3 kids. I'm a former food banker. I worked in Oklahoma. I know how hard it is for kids in rural Oklahoma to get to an after-school program, to get their meal for after school. It's next to impossible for some kids. So we really have to rethink how it is we help families and children access the nutritional resources that we are making available to them so that they can learn, so that parents have the support they need. So we're excited about that reauthorization and being able to advocate for much greater flexibility and to make our policy fit a modern American family in America today.
I think there's been some really great legislative efforts that have taken place in response to the pandemic, right? Things that were critical in making sure our students, our kids, families could get access to food. And I think what's going to be so important moving forward is that we don't just go back to the way things were before, right? We need to use this moment, as Craig said at the very beginning, as a wake-up call for our country, right? The importance of food and putting the priority on food. I think all of us at Craig's table agree that, food really should be a human right. Like nobody should be going to bed hungry, every day. It's just, it's unacceptable. And there is so much that can be done. So at World Central Kitchen, we are really pushing and advocating. We have a new administration now, and they're listening. They're listening to all these issues. We really believe that we need food to really have a sort of multi-pronged approach, that food can't just live in the U.S. Department of Agriculture, right? Food touches education, food touches commerce, food touches health and human services. So we can't sort of pigeonhole food just into agriculture. We need to sort of have a view across agencies and throughout the entire government. So I think there's some real possibilities to do some great things in the very near future. We have to keep the pressure up at the federal level, at the state level, at the local level. And I think there's a lot of learnings that can come out of this moment. One of those that World Central Kitchen is working closely with is FEMA, our federal emergency management agency that responds to disasters, and pushing FEMA to really recognize food as a critical service that needs to be provided in the aftermath of disasters. And that could be a global pandemic, could also be the hurricanes and wildfires that are facing our country right now. So again, continuing to push food front and center and recognize that there's a lot that we can do. And if we work together and move forward, I think we can really make some progress in the months and years ahead.
And I think you have really touched on the systemic issues and the broader issue and how you do that long term. But Craig, do you want to add to that how you approach it as a systemic problem, what you do long term?
Long term, the idea, well, first we got to get people fed every day and maybe get their pantries full so they can continue eating beyond that. Afterwards, well, we need to work together to get people, to get people trained in jobs, real jobs, that will put food on the table as they go through their lives. For example, DC Central Kitchen is planning on a new facility to that effect. The idea is take care of the here and now and in the very short term, but then to work with some of these groups to look into the future such that people can find how to put food on the table on a moving on basis. My focus isn't that because that's what I don't know much about, but I do know that we can work together, particularly with vets and active service members with all their families, to get people to be fed in the here and now. So you hand someone a fish and they get fed for the day, you teach them to fish, and then they can feed themselves. Well, I'm not that smart, but the people around me here are.
Okay, let's talk to a couple more then. Katie, why don't you look at the long term? And I know again we've touched on this, but it's so important when you look long term.
Yeah, so I mean, just to build on Craig's comment, there's a language we use in the Feeding America Network, which is feed the line and shorten the line. So exactly that same idea, that there's a body of work that we all are doing together and should be doing to make sure that people today have the nourishment they need to work, to learn, to live, and to reduce their anxiety so that they can go on another day. But that's not good enough because these are systemically driven issues. Food insecurity is very much a symptom of economic insecurity, of the other kinds of barriers that exist for people. So we have, in partnership with communities all across the country, food banks are working to address racial disparities, address housing issues, address workforce development, like Nate and Craig were talking about, so that people can find pathways out of food insecurity. Some of the things that we are doing include the policy world, even though we like to be in allyship with those who know even more than us, like Craig said, and be partners with them around those critical issues that undergird and kind of create food insecurity. But then we also work very hard to invest disproportionately in communities where there are disproportionate levels of food insecurity, in communities of color, in rural communities where food insecurity exists at a higher, more disproportionate rate than in many urban metros. This is an issue that is pervasive across our country, and we've got to address it not with a one-size-fits-all solution, but really by addressing systemic drivers of food insecurity and making sure we're investing in communities that especially need our help and our partnership.
And Karen.
So I love this conversation because I do think that food insecurity is a systemic issue, and it is not just about food. I've come to start to think about food insecurity really as nutrition insecurity. It's not just filling bellies, it's getting people the nourishment, the real food that they need. And I think that does start, as Nate was saying, in the agriculture world, but it absolutely affects every other part of our government and every other part of our civil society. And when people don't have access to good food, they can't learn, they can't work, they can't be good community members. It all starts very much in that, in nourishing the body. And so I think that it is systemic. I'm going to start with one of our mottos, which is that food is medicine and food is love. And people need food. It's a basic need. It needs to be something that, as a society, we all take on. That there are people who, like the people we serve, who need food to manage their illness. There are people who need food just so that they don't, as somebody said earlier, go to bed hungry. We need to be able to support local sustainable efforts to ensure that the veterans we want to reach and all the people we want to reach have access to good, healthy, nutritious food that really gives them the best chance at the best life.
You can help a local organization. They always need cash. They always need people to help out. If you want to go national, the group cited here can help you with that as well. We are all in this together. That's maybe the biggest lesson of the pandemic. And we need to help out now. And in the future, there'll be more to help out on.
Nate.
I think we really have to recognize that we don't have a food problem in the United States. What we have is really an equity problem and an access problem. And I think when we start to really shift the way perhaps that we think about the issue of hunger into a bit of a different lens, I think we can start to come up with new solutions and new approaches and shift our priorities a little bit and recognize what it is that we collectively need to do. So important today talking about our military families and veterans. And one of the things that our founder of World Central Kitchen, Chef Jose Andres, says is, we have to also look at food as a national security issue, right? Imagine if we were addressing hunger the same way we address Homeland Security or other issues related to our military, the investment, the support. And, we really need to do the same with food. We need to look at, how it impacts us as a country, how it affects, certain populations more than others, and what we can do to really put all of our resources together. This is a solvable problem, as Karen said, but we just need to really work together, come up with new solutions, and make it a priority and make it something that we ensure that the next generation is not going to have to face the levels that we see today currently.
I think all too often there's a stigma in the veteran community for asking for help. So my message to every veteran service member and military spouse, and I wish I could look you in the eye, like Kate said, so I could communicate this effectively, is that there are resources available for you, just building on what Nate said, and you and your families have earned them. So don't be shy to ask for the help that you need. I was talking about this topic with one of my colleagues. He's a retired Command Sergeant Major, Keith Wickham, and he said to me he dealt with this all the time in the Army where people were too proud to get the help that they needed. And he, said back to me, you can't feed a baby with pride. So I just want to reiterate that my spirits are lifted from this conversation. I feel like we can do it. And I'm delighted to have the opportunity to work with such experienced people who have open minds and are reimagining what's possible. And they say that, when there are tough times, that's necessity is the mother of invention. And I think one of the silver linings of a really, really tough year in 2020 is that we've come together and that we're tackling this and we're having the conversation.
Craig, I want to ask you one more question. And we all know how generous you are. We know how wonderful you've been to the veterans and military community. And I know you are very humble and very modest, but I just want to know what this has meant to you, what you've seen, the help that you have helped provide. What does it mean to you?
The answer may be not very representative of how humans react. For me, it's just that like a nerd's got to do what a nerd's got to do. There are bases for this in religious belief. Leonard Cohen has taught me a lot. But basically all amounts to what feels right to do. And one of my primary identities is that of a nerd, and forgetting about normal social affect. It's just that I'm doing what I feel that I have to do and not think about it very much and then think about what's next. I only wish I could be funny.
Well, you are our favorite nerd, and not all nerds do what they need to do. And we are so grateful for what you do. Thanks, Craig. And Anne-Marie, I want to end with you on a couple of points here. What is the goal for the Bob Woodruff Foundation in combating food insecurity, and especially there your work with Craig and Craig's table?
Sure. Well, I mean, this is an all-star cast of people, so I think we can certainly learn from this amazing group. We at the Bob Woodruff Foundation are learning, so when I'm talking, I'm really bringing the lens to represent veterans and military families to the conversation about food insecurity. Craig, who's being very humble, he recognized this trend early on. He committed $25 million of his own support in the past year to combat food insecurity in the U.S. And the Bob Woodruff Foundation, we're proud to be one of the organizations that Craig is generously supporting through what we are all, you've heard us reference Craig's table. We're grateful that Craig's, not only supporting veterans, but he's asked us to be a part of coordinating what we're now calling a super group of food organizations, many of whom are here today, to ensure that veterans' needs remain part of the ongoing national dialogue on food insecurity. And the idea here, and you hear us all saying this in different ways, is that we believe in collective impact. 1 + 1 has got to be more than 2. Each of the Craig's Table partners are doing amazing work, as you're hearing about. And what we're trying to do now, and Craig has been an impetus for a lot of this by introducing us to one another, is coordinate our efforts and support each other. We know, I'm saying this with a smile, but we're stronger together. So the goal, I think, is that we help, at the Bob Woodruff Foundation, we want to help veteran service members and their families thrive long after their time in service. And if that means starting with tackling food insecurity, because we're talking about basic human needs, then we'll start there. And to combat this issue, we're trying to network these networks together. Craig Newmark, like I mentioned, has really inspired us with his vision. And we're going to do everything we can so that no veteran or military family member or active duty service member goes to bed hungry. And to all of that, to military families out there, I just want to tell you, we have your six.
Thank you to all our panelists today. A lot of the work to combat food insecurity can't happen without boots on the ground. To highlight the need and work being done in this unprecedented year, please take a look at this short video.
Arizona has many tribal nations that are within our state's boundaries, and serving our tribal veterans and their family members is a very high priority. I'm a spouse of a veteran, so this work in collective impact, community building, and program development is a personal passion of mine to ensure that our military and veteran and family community has all the support they need.
Our areas can be very long, be very far and distant. During the pandemic, specifically, a lot of our tribal communities were on executive stay-at-home orders to keep their communities safe. And so a lot of the tribal communities were needing support. We've done a lot of projects to ensure food boxes were delivered to tribal communities.
We funded their emergency COVID relief efforts in northern Arizona, which included emergency financial assistance, collaborative relief projects, and that included firewood distribution and manufacturing and delivering 300-gallon water containers to households without running water in the Hopi Nation.
I'm just really honored to be part of this community, and it is through the partnerships that we have here in our community, as well as partnerships like the Bob Woodruff Foundation, that allow us to expand our vision of what's possible, improve how we're able to deliver support, and truly just move forward so that we are meeting our mission to serve our military members, veterans, and their families.
Syracuse University's Institute for Veterans and Military Families found that as many as 40% of veteran military households have experienced food-related needs during the pandemic. This data corresponds with evidence collected by the Bob Woodruff Foundation, showing a sharp increase in requests for food and meal support from military and veteran communities nationwide this past year. Our next guest is James Hendon, Commissioner of the New York City Department of Veterans Services. Prior to entering the civilian workforce, Commissioner Hendon spent 7 years in the U.S. Army as an active duty infantry officer. With his firsthand experience, he has deep insight to the unique stressors for military families that can lead to increased food insecurity. Most importantly, he also has insight to solutions for these challenges and the community. Welcome, Commissioner Hendon. It's great for you joining us this morning. As you know, the Bob Woodruff Foundation has been working with the Department of Veterans Services since 2018, and we really do appreciate you joining us for this important conversation today. So let me start here. How have you seen food insecurity for military families and veterans change over the years?
Well, first off, I just want to thank you so much, Martha, for having me today. Also, extend a thanks to our good friends at the Bob Woodruff Foundation and Craig Newmark Philanthropies. When I think about food insecurity and how things have transitioned over time, you've got to think about the changing demographics of the veteran community as one factor. When we look at, I tell people I was born in 1980. Back then, 18% of all Americans had served in the military. Fast forward, according to 2018 data, that count is down to 7%. And we're on a trajectory where by 2046, it'll be about 3.3% who will have served. And so when, we deal with issues involving food insecurity, we've got to remember that fewer and fewer of our non-veteran brothers and sisters recognize or know about these issues or are mindful of them. It's all the more valuable to us when we have partners like Bob Woodruff and like, Craig Newmark. The other piece is the pandemic. When we look at what is happening with COVID-19 prior to the pandemic, 1 out of 3 New Yorkers reported experiencing some form of food insecurity. You look at the Feeding New York report, it was about 1.4 million who had relied on food pantries or gone to soup kitchens, and roughly 1.2 who would say outright, hey, I'm food insecure. So when you add the pandemic onto this and you look at these demographic shifts in the veteran community, and before I forget, the aging piece, the percentage of society is declining because we have fewer people who are serving. So if you think about when we shifted from going from a draft military to an all-volunteer military, come 1973, in New York City, more than 70% of our veterans are 55 or older. And we think about older individuals, you think about that fixed income. You think about folks who are in a position where the shocks of what's going on economically hit all the more acutely.
And go into the difference between the civilian and military families. Military households really do face a lot of stress, a different kind of stress than civilian families. So talk about what factors contribute to food insecurity, especially in the military community.
For the military, and something that has to undergird this and why it's so important, and we're grateful for our friends at the Woodruff Foundation, is, many people don't think that this is an issue, but it is an issue. When we think about military families, I'll just speak to New York City. When you look at, as an example, someone who's an E3 or someone who's a private first class, someone who's entering the military, that person with their dependents would receive about $62,000 here in New York City for themselves and for their family. So assuming a family of 4. And so there's this disconnect when we look at our lower enlisted, which make up a majority of the force, and what their compensation is and how they can leverage that compensation to not be food insecure versus their counterparts in other areas. And New York City is one of the most expensive places in America, but this same story can be told throughout the country, where one piece of it is this break between the pay of our lower enlisted personnel and what is the reality on the ground for them. So you could have someone who has an advanced degree, who has the appropriate training, but who is constantly moving from place to place to place, and for whom it's hard to find a good job where he or she can contribute to the household income. So these are other reasons why we see these issues directly impacting those in uniform.
And I think people often forget about how difficult it is for a spouse to get a job when they move around. And you touched on this, obviously, but this is all exacerbated by the pandemic in a very big way, food insecurity.
It is. When I think about the pandemic, think about it as something that's revealed so many underlying issues we have already had in society. And so I completely agree. When we look at, just to tell a veteran story, prior to the pandemic, the unemployment rate in the veteran community was 3.1%. At its height, it reached 11.7%. Right now, it's at 4.5%. We're still working to close that gap, but just use that as almost a bellwether of where we are on issues that involve food, that involve housing, that involve healthcare, that involve employment, where there's this direct correlation between things that are brought out by the pandemic and the needs that our veterans and their families have.
Commissioner, I have spent much of my career around the military, so I know they have contingency plans. So what did the Department of Veteran Services do to pivot when the pandemic hit to accommodate all these kinds of restrictions and social distancing and mask wearing? What did you do about that to pivot?
So for us, Martha, I like to think that we, went forward in the time machine, went backwards in the time machine, and we just strengthened the relationships with our friends. When it comes to going forward in the time machine, we leverage technology to an extent we never had done so before when it comes to remote communication and remote services that were offered to our veterans. Everything from helping veterans file their service-connected disability claim to making veterans aware of different offerings that we had in areas like food, housing, employment, and healthcare. As far as going back in time, the food work in particular is an example of just a logistical operation where it was needed every single Wednesday, every single Friday, to have veterans who would come as volunteers to help prepare food and then deliver it to our homebound veterans. So we leveraged 25 different veteran service organizations on any given Wednesday or Friday who were picking up and distributing what came out to be more than 100,000 packages of fresh food that was sent to our various veterans, particularly our homebound food insecure veterans. And then when it comes to just shoring up good relationships, we couldn't do this without support from incredible organizations like the Bob Woodruff Foundation, like Craig Newmark Philanthropies. We would constantly rely on different groups and stakeholders in this space, new and old, to provide various resources that we would use to distribute things to our veterans in need. For instance, thanks to the Woodruff Foundation, we were able to deliver 400 turkeys using that same logistical supply network to various veterans for the Thanksgiving season. Thanks to BWF board member Fabrizio Ficini of Italians Feeding America, we were able to distribute over 400 pounds of meat and other fresh food to a veteran food pantry in Queens, along with other ingredients. And so a piece of it is leveraging technology. A piece of it is having an old-fashioned supply chain network that can do right by people. And another piece of it is working with great friends like the folks at Bob Woodruff Foundation.
And Commissioner, just finally, what do you expect in the coming year in terms of this collaboration? What are you hoping for?
I hope that we can go onward and up with this, that we can continue to be more viral with the things that we do. So far we've fed in partnership with several groups, including the Woodruff Foundation and Newmark Philanthropies, more than 100,000 veterans. There are 210,000 veterans in this city. We want to make sure that any of those veterans and their families never has to deal with food insecurity or the idea of dealing with hunger. So we just see things going in the right direction moving forward and continuing to connect, to mobilize, and empower all of our service members, past and present, in addition to their loved ones.
Thank you so much, Commissioner Hendon. As we know, boots on the ground continue to service this military community. Please take a look at another short video highlighting this essential work.
I personally got involved in Combined Arms after I transitioned from the service. During the transition process, reconnecting with your community and having like-minded individuals that you have shared experiences with, that you've built camaraderie with, that understand the trials and tribulations and understand the transition process just as well as you is paramount to a successful transition. And one of the great things about Combined Arms is the data in our system shows that. So the Combined Arms technology is incredibly malleable. It's accessible via desktop computer or mobile application. And it's a very simple process for a veteran or military family member. They simply go to the website or go and download the mobile application. And they create a profile quickly, fill out some basic demographic information, and then execute assessments based on their specific needs. The technology is our nucleus. It's our living, breathing organism that shifts and adjusts to meet the needs of the veteran and military families.
Combined
Combined Arms identified food insecurity as a growing issue in their community before the pandemic and built a partnership with the Houston Food Bank to hold pantry days to bring food to where veterans are.
Texas Veterans Network is a statewide initiative that will make Texas the first interconnected state for veterans and their families. It is an extension of Combined Arms' great work that started in Houston, and essentially we're taking that same model, methodology, and technology to support more regions across the great state of Texas.
My hope that Combined Arms has for the future in tackling food insecurity is to be able to continue to target high-risk communities that we see with data that have food insecurity issues. And so by providing that complete continuum of care with our service provider network, we feel that we can accurately reduce the demand and request for food insecurity in the years to come.
We want to thank everyone for joining us to talk through the important issue of combating food insecurity within the veteran community. We can all do our part, and we will leave you now with final words from Anne-Marie Dougherty, Chief Executive Officer of the Bob Woodruff Foundation, and how you can get involved.
Thank you so much, Martha. The Bob Woodruff Foundation is dedicated to raising awareness of the prevalence of food insecurity in the military veteran community. We understand food insecurity is not just about hunger, but impacts overall veteran and military family well-being. Our work is just beginning, and here are 3 things you can do to help. 1, help raise awareness of the food insecurity challenges millions of Americans are facing every day through your personal networks and social media platforms. 2, volunteer at your local food bank or by delivering meals to those in need. And 3, donate to the Bob Woodruff Foundation or any of the wonderful organizations featured in today's program, including Feeding America, World Central Kitchen, God's Love We Deliver, the Arizona Coalition for Military Families, and Combined Arms, or to other food organizations doing important work in your community. We want to thank you again for joining our program. And to all the veterans and military families out there, we've got your 6. You can find more information on our website at gotyoursix.bobwoodrufffoundation.org.